Some health news now happening this month. Health leaders are warning you about a rare and deadly eye cancer that can develop without any symptoms. WSFA 12 News reporter Bethany Davis is live this morning at the Eye on Grace Foundation, a nonprofit dedicated to these patients. And Bethany, that foundation is making a big difference.
Listen, because this is so rare and treatment is so specialized, nearly every person who's diagnosed with ocular melanoma is forced to travel for treatment, which, as you can imagine, can be a huge financial burden on families. So that's why Ashley McCrary founded the Eye on Grace Foundation to help families cover the cost. And this month, you're using the Eye Patch Challenge to help raise money. Let's just talk a little bit about the cost, though. Talk a little bit about how far patients generally have to travel. How does that add up for families of patients?
It's a great question. We've learned that 92% of the people who are diagnosed with ocular melanoma have to travel at some point in time during their journey, whether it's just from here to Birmingham or from here to Philadelphia, Pennsylvania. And so we've seen that it could be the cost of gas, the cost of flights, when you think of also hotels, Ubers, parking, food. It really does add up. So the average trip that we've seen is anywhere from $680 to $1,500 if two people go together. And you know, you want a person to go with you when you're hearing this kind of news. So that's what we've learned over the years in terms of the cost. It could be financially devastating.
Wow, that is incredible. Okay, so you're using the Eye Patch Challenge to help you raise money to help more patients afford their travel better. How does it work? What do we do?
Okay, so it's a fun little activity. You remember the Icebox Challenge that we did for ALS. So we have eye patches that we will send out for free. People just have to email the eyeongracefoundation.net. There's a way that you can contact us, and we will send you eye patches. We encourage people to put it on. And our biggest thing is we want to raise awareness. If people will go and get a dilated eye exam, that's the gold standard to be able to find this type of cancer. It is very, very rare. So we want to encourage that. We want to raise awareness about ocular melanoma and how rare it is, and yet it's something that we need to be considerate of. And then we want you to challenge 5 other people to actually put an eye patch on and even do an activity. Maybe it's doing an email, getting a cup of coffee, getting on the elevator, going downstairs, maybe a round of golf with just an eye patch on, and make a donation to the Eye on Grace Foundation. So those are the protocol that we have in doing the Eye Patch Challenge, but we will send this to you for free if you would like to participate.
Yeah, just to give you an idea of how rare this eye cancer is, it only occurs in about 6 out of every 1 million people, but it is the most common primary eye cancer in adults. So this morning, we'll dig a little deeper with Ashley about ocular melanoma, exactly what it is, what it's like to live with ocular melanoma later this morning.
All right, Bethany, and statistics show only about 30 people in Alabama are living with this type of cancer.